Welcome to the e-module on planning the evaluation, brought to you by the Program Evaluation Unit at the Sing Health Duke-NUS Global Health Institute. By the end of this module, you will be able to explain the major concepts in project evaluation and different types of evaluation and their purposes. Let's start by looking at the key components of a comprehensive evaluation plan. We can think of it in four parts. The what. This defines the scope of the evaluation, including the specific goals and objectives of the program, a clear and concise logic model illustrating the program's theory of change, the inputs, activities, outputs, outcomes, and impact, and a statement of the overall purpose of the evaluation. For example, to assess program effectiveness, to inform future program development, or to demonstrate accountability to stakeholders. Consider including specific questions you aim to answer. The how. This outlines the methodological approach, including the specific study design, for example, quantitative, qualitative, or mixed methods. The data collection methods to be employed, for example, surveys, interviews, focus groups, or administrative data. The key indicators that will be used to measure progress and success, and a description of how the data will be analyzed. Who, when, and with what. This covers the detailed implementation plan, clearly identifying roles and responsibilities for each member of the evaluation team, outlining the timeline with specific milestones and deadlines, and detailing the budget, including resources required for data collection, analysis, and reporting. This section should also detail any necessary ethical considerations and approvals. And finally, the why. This addresses the dissemination and utilization of the results, identifying the key audiences who will benefit from the evaluation findings, for example, program staff, funders, policymakers, community members, outlining how the findings will be disseminated, for example, reports, presentations, or publications, and specifying the format and content of the final evaluation report. Consider how the findings will influence future program decisions. The first crucial step is finding out the what, i.e., the scope of your evaluation. To do this, you need to identify all stakeholders involved in the evaluation, determine the stage of program or project development, such as planning, ongoing, or completed, clarify the purpose of the evaluation, identify who will be using the results and how they intend to use them, establish logistics and a timeline, gather relevant information about the program or project itself, and formulate your key evaluation questions. Determining the stakeholders is critical for a successful evaluation. We will delve into different types of stakeholders, their levels of involvement, methods for analyzing their relationships using matrices, and techniques for effective communication and engagement. According to the CDC, stakeholders are people or organizations invested in the program, interested in the evaluation results, and/or have a stake in how those results are used. We typically categorize stakeholders into three main groups: those involved in program operations, such as management, staff, or funding agencies; those served or affected by the program, including patients, clients, advocacy groups, and community members; and those who will use the evaluation findings, including policymakers, funding agencies, and taxpayers. Effective stakeholder engagement is key to the success of any evaluation. You need to identify specific stakeholder individuals involved throughout the evaluation. You should create a list of key stakeholders and their roles. You should also engage these stakeholders in the design and ideally all stages of the evaluation. This can be achieved through various methods such as interviews, focus groups, surveys, or regular meetings. Consider establishing a stakeholder advisory group. You'll have to develop a communication plan. This is to ensure transparent and timely communication with stakeholders throughout the process. This will keep stakeholders informed and build trust. You should also address stakeholder concerns and feedback. Be prepared to address any concerns or objections that stakeholders may raise. After stakeholders are identified, the stakeholder map requires analysis to determine which stakeholders to approach. Analysis requires prioritization of different stakeholders because it is not feasible or necessary to engage all stakeholders with the same level of intensity. One useful tool is a power versus interest grid. These grids place stakeholders on a 2x2 matrix, where the y-axis is the stakeholders' political interest in the quality problem, and the x-axis is the stakeholders' organizational power or control over the system. 4 categories of stakeholders will result: players who have both an interest and power, subjects who have an interest but little power, context setters who have power but little interest, and the crowd with little interest or power. In this way, power versus interest grids help identify stakeholders who should be involved in the project and considered for the improvement team. We call these players. Power versus interest grids also allow us to determine the intensity of engagement strategies for other stakeholder groups. Of course, there will be greater intensity for subjects and context setters than the crowd. There are different ways to structure the evaluator-stakeholder relationship. For example, independent evaluation. This is where the evaluator takes primary responsibility for planning, conducting, and disseminating the results. Then there's participatory or collaborative evaluation. This is a team approach that involves the evaluator and representatives from stakeholder groups. Another structure of the relationship is empowerment evaluation. This is a participatory and collaborative approach where the evaluator guides stakeholders to conduct the evaluation themselves. Understanding the project stage, be it planning, ongoing, or completed, shapes the evaluation approach and the types of questions asked. The 3 stages are planning, ongoing, and completed. The planning stage focuses on needs assessments, feasibility studies, and logic model development. The evaluation planning occurs here. Ongoing project, where process evaluations monitor implementation, identify challenges, and make adjustments. And completed project, when outcome and impact evaluations assess the overall effectiveness and long-term effects. Sustainability and scalability are considered here. Determining the evaluation's purpose is crucial. We'll explore different typologies and whether an impact evaluation is always appropriate. Consider these questions when defining the purpose. Is it to determine the needs for the program? Is it to determine whether the program was implemented as planned? Is it to determine whether any changes in outcomes occurred? Is it to determine whether those changes are due to the program? And is it to optimize context-specific implementation strategies? This is the evaluation framework we use at SDGHI. First, you need to identify the stage your project is in. For example, the planning stage. You would conduct a needs assessment to determine health needs, unmet needs, and the necessary actions to take. You can refer to our e-module on needs assessment for guidance. Is it an ongoing project? Here, you would perform a process evaluation to assess whether the project is being implemented as planned. This evaluation will help identify the strengths and weaknesses of the implementation. Is it an ongoing or completed project? Here, you would conduct an effectiveness evaluation to determine if there has been any change in outcomes. This focuses on the immediate effects of the project. Is it a completed project? Here, you would carry out an impact evaluation to assess whether the changes in outcomes are attributed to the project. This evaluation emphasizes long-term effects. Or is it a completed project or new project based on findings? Here, you would conduct implementation research to design a new project based on research findings in a different context. When deciding on an outcome impact evaluation, consider factors like sustainability. Does political and financial will exist to sustain the intervention? Fidelity. Does the actual intervention implementation match the intended implementation? Stability. Ensuring the intervention is not likely to change during the evaluation. Reach. Does the intervention reach a sufficiently large number of clients, sample size, to conduct an appropriate data analysis? And dosage. Do clients have sufficient exposure to the intervention to result in the intended outcomes? Who will use the evaluation results? Identifying users is crucial during stakeholder engagement. Their support increases the likelihood of using results for program improvement. For example, program staff might benefit from detailed information on program implementation, while funders may be more interested in overall program effectiveness and cost-benefit ratios. Policymakers would require summaries of findings that are relevant to their decision-making processes. Develop a communication plan early in the process to make sure that the results are effectively disseminated and used. How will the results be utilized? How are users planning to use the results? Potential uses include documenting success in achieving objectives, identifying areas for improvement, deciding on resource allocation, or mobilizing community support. More potential uses include redistributing or expanding program locations, improving program materials, focusing resources on specific populations, and soliciting more funds or partners. Logistics and timeline. When planning a project, consider the necessary resources and logistical aspects. Some outcomes are easier and quicker to measure than others. It's important to ensure that the project has adequate funding and staffing. Developing a realistic timeline is essential for effective project management. Consider factors such as data collection methods, analysis requirements, and reporting deadlines. Incorporate milestones and checkpoints to monitor progress throughout the project. Using a Gantt chart can help visualize the timeline effectively. Budget allocation should be aligned with the timeline and the resources needed. Gathering program information is essential. Thorough background research is essential to develop a relevant and impactful evaluation plan. This will improve the quality and relevance of the evaluation. You'll need to understand the problem the program addresses, the target population, and the program activities. You should also consider the program's goals and objectives, the program's stage of development, and the context that influences the program's success or failure. Identify key evaluation questions. Developing clear, concise, and measurable evaluation questions is essential. These questions will guide the entire evaluation process. They should be SMART, specific, measurable, achievable, relevant, and time-bound. You should ask yourself, what needs to be answered as part of the evaluation? Try and remember to avoid vague questions. You should limit the number of questions and frame questions to be answerable. And finally, avoid questions with already known answers. Different evaluation types, such as process or impact, have their own sets of key questions. For process evaluation, this focuses on how the program was implemented. Questions address fidelity, reach, barriers, facilitators, etc. For outcome evaluation, this focuses on changes in the program's intended outcomes. The questions address whether the program achieved its intended results. For impact evaluation, questions should address whether changes in the outcomes can be attributed to the program or project. To conclude, as an evaluator, after you have been hired, your first steps are to find out the what. This means understanding the evaluation's purpose, determining how the results will be used, understanding the program's development stage, determining the resources and budget, describing the program to be evaluated, the needs, target population, activities, goals, and objectives, and beginning to formulate key evaluation questions. Thank you for completing this e-module on planning the evaluation. Please contact us or follow the SingHealth Duke-NUS Global Health Institute on LinkedIn for updates from the Program Evaluation Unit. We hope this module has equipped you to design effective evaluation plans that contribute significantly improving health outcomes.